Hello and welcome to the program. In 2018, the Ukrainian Ministry of Health launched a healthcare reform data breaking free of this Soviet tradition and restructuring Ukraine's stodgy medical system, making it affordable, more transparent, and information-driven. Now, today we will try to compare Ukraine's healthcare model with a British one. Joining us in our studio to explain on this topic is Gianluca Colucci, Fellow of the Royal College of Surgeons and leading surgeons. Hello, and thank you for joining us today.
Thank you for inviting me here.
So my understanding is that you're here for a symposium, so in Kiev, called Life Surgery 2.0 Experience of Great Britain, USA, and Ukraine. You were a participant there. Can you outline the general outcome of this symposium?
Well, the idea was to exchange our experience with the colleague here from the hospital in Kiev and generally with other surgeons, trying to bring our opinion and the way we work, both on keyhole or laparoscopic surgery and another aspect in surgery in general. So an exchange of opinion and trying to see how we can start a collaboration.
Now, what would you say is the main characteristic of Ukrainian surgeons that you met? Would you say that there is a good trend happening in practice and things like that?
Yeah, absolutely. It's quite astonishing the level of surgery that it can be offered here, considering that, for example, in keyhole surgery, there's a highly dependence of technology, and still is very good level of surgery. Clearly, medicine in general is something in continual evolution, and it's quite unremarkable that people approach us and open and trying to evolve and following the trend, especially for oncological surgery, while the change is around the corner every day.
What would you say the challenge are for Ukrainian doctors today and surgeons in general?
Well, I would say that the first is to follow this change from tradition to new guideline, new approach. And then my impression, being a colorectal surgeon and being exposed in these days to the reality of colorectal surgery, is the problem with screening, prevention, as it seems to me that most of the disease that is picked up here is still quite an advanced disease because of the lack of screening and early detection of cancer.
So it's a question of technology or means put behind it, you would say?
Well, it's a mix of the two. Screening is not something that comes from the surgeon. Where I come from is a support that comes with a health global process, where we have a hub, and for example, for colorectal cancer, all the inhabitants from the age of 60 to the 74 are every 2 years offer a test to check the presence of blood in the feces. Clearly that then lead to tests and lead, has been extremely proved, to early detection of cancer or detection of polyp that remove early, stop the cancer to develop. And this is something that has been implemented. Clearly comes with cost, clearly comes with a lot of effort that has to be put in, but the payoff is incredible for the general health and for the patient.
So it's also a question of mentality, basically, to push people to say, like, okay, I'm going to get tested regularly from a certain age.
Yes, and is a mentality, is not only that, is being able to create the structure to remind people to have the screening, to follow them up, to have a registry and keep that updated. So it's clearly a major undertaking. The good news from that is that such a big, important and big effort, even economically, is paid off with proven result to prevent death, to improve quality of life, and have cancer detected very early. That means the chance to survive the big disease. Bear in mind that colorectal cancer is overall the it's the third most common cancer, so it's something that is take quite a big chunk of our resources.
Now, in the symposium, there is this comparison between different healthcare systems. Ukraine's healthcare system is still developing in a certain way. But how could you compare, and how is it comparable when you have those completely different systems between the NHS, the American insurance healthcare system, and Ukraine? What is the alternative here, and what can Ukraine do and learn from this system,
Well,
would you say?
it doesn't matter in which system you work. The focus for all us is our patient. And when you keep that in mind, then you're trying to use the best of the resources you have to do the best for your patient. Clearly, each system has its own limitation, and limitation that comes to the support, the finances, the support that you have. What I saw today, what I saw in the last 3 days during this conference, is that there is a big push, there is desire of people to integrate and to move forward, to share ideas, to somehow get out of the eggshell and start communicating. And yes, there is a bit about reading, technology, access to information, but a lot of that comes to discussing, confronting. So for example, I led on a small group where we were just discussing cancer cases, and I was really impressed. Yes, there is a mentality, there's a difference in how we treat them, but I was really impressed by the vitality, why the way there's sparkling energy in the room about discussing and looking forward. So I think that the comparison has clearly showed the differences and the limit, but it's a good push to say, okay, move on, just trying to get the best out of every system.
So would you say that this push comes from the doctors, or because the acting health minister, Ulyana Suprun, has, let's say, Western education and came in Ukraine with a certain Western expertise? Would you say that there should be more individuals like that coming with a Western expertise in Ukraine and bring that expertise, or work differently?
I think that is, as I said, is a combination. Clearly is important to have exchange. The exchange are always bilateral. People will come and see what we are doing. We can bring something here. I think is the passion to trying to improve what we do for our patient, and the support to exchange, support that comes obviously with an economical support, time support, energy support. Because again, I want to reiterate, I was really impressed how much passion and already how much good is done with, honestly, what we think is reduced technological availability. But this is, you know, I compare where we work, we do not have access routinely to robotic surgery, while our colleague from the States has robotic surgery. So technology is important, but what is more important is sound oncological principles, sound surgery, following guideline. And I think that one of the other key message that I perceive is that this passion about changing the guideline, trying to restructure the system as a globality, as an approach.
Now, one of the problem that Ukraine's healthcare system and health system in general, as you said, despite the passion and despite the expertise of certain doctors, is that the system is, and it's well known, under-equipped. In your opinion, how to deal with it? Is it some sort of like long-term political and economical kind of guideline and framework, or is it possible to circumvent that problem?
Well, is a slow but deliberate action to plan for the future. Is maximizing the action, see what are the key points where you can invest to achieve the most, invest in the less. And this requires a very strong leadership and vision for the future, because clearly, as a doctor, you are quite limited, while the overstructure has to have this idea to look and supervise the system. Clearly, it's my first experience in Ukraine, and I don't have much experience in public health. My personal perception, as I said, a different leadership can change much, but it's also very important to be focused in what you invest and have a look as short-term investment, focus investment in the short term that may have massive effect on the long term.
So would you say, even once and again, even if it's your first time in Ukraine, would you say you would have spot these key sectors where the short-term investment could be? I mean, once and again, it's just a symposium of 3 days. But.
So, clearly, clearly it's very difficult, and I would find overrating myself, having been here and in hospital for a few days, to come here and give advice, so that needs to be changed, that to be changed. I think, as I said, it's a long process. It's trying to understand what are the key points, what can be done for moving forward. Clearly, with my eye, there is a need of some investment in technology and resources, because what we do require technology, resources, instrument, tools that they comes with a tag price. And being a surgeon, that technology has significantly changed the outcome that we obtain. But again, I think that is more a global system where you have to identify. Reiterating what said back, some of the investors on the short run, they can seem to be counterintuitive. So why should I invest in screening when I have advanced cancer? But the screening that we invest now on the long term prevent cancer to happen, and they save on the long term a lot of money. But this sort of vision has to be strategic and led.
Now, we talked about the potential benefits that Ukraine could have from Western countries, and this comparison between a healthcare system. Would you say that Ukraine, even if its system is still changing and still developing, would you say that Western country and the West in general and Western system could learn something from Ukraine in this system which is emerging?
Well, I believe so, because obviously you're talking to a surgeon, so we are talking about very technical operation and bit. But we come from very different school of thought. There is technically bit that I appreciated and we talked about. Some of that are very technical. There is a passion probably coming from a different background for different technique. And always, I think that when there are differences, when you discuss and you build up on differences from both sides, there is something that can be learned. And if I had a key message, a take-home message for the end of the symposium was exactly that. We never come to teach. We come to raise doubt, because you change your practice when you have a doubt. You doubt your technique, you discuss about what you do, and you look for something better. And I have to say that of some of the discussion, I'm going to leave Kiev thinking about if some of my principles should be changed. And this is the discussion that was arise from the panel and the discussion we had.
Now, and to conclude this interview on a more personal note, it is indeed your first time in Kiev. Will you come back, and are there other symposium and other exchanges that are scheduled?
Well, I have to say that I strongly hope to come back and to be invited again. I think that looking at the symposium and the interaction with the people in the symposium, I will really hope to be able to arrange some focus workshop for the surgeon in training, and that's because training is one of my passion, and I think that there's something that I can bring in training, and it's a beautiful city where to be, and I really look forward, if possible, to come back again.
Well, and it will be a pleasure to have you in our studio to continue that talk. Thank you for joining us today. That was Gianluca Colucci, Fellow of the Royal College of Surgeons and leading surgeon. Thank you for watching the program, and stay tuned for the rest.